The federal government has called for stronger pan-African collaboration to tackle the continent's growing cancer burden, warning that cancer now kills more Africans annually than HIV/AIDS, malaria, and tuberculosis combined. Minister of State for Health and Social Welfare, Dr. Isiaq Salako, made a call on Saturday while addressing delegates of the Africa Oncology Collaboration and Innovation Forum in Luxor, Egypt. The event tagged the organizer of the Africa Oncology Collaboration and Innovation Forum 2025 was organized by the forum's planning committee in partnership with Egyptian oncology institutions, African oncology networks, and development partners. According to Salako, Africa recorded 1.18 million new cancer cases and 763,843 deaths in 2022, based on global CAN data. It described the figures as unacceptable burden requiring collective continental action. It noted that Nigeria, Egypt, and South Africa jointly account for the highest number of cancer cases in Africa, with Nigeria alone responsible for over 10.5% of the continent's total cancer burden. He attributed the rising incidence to lifestyle factors, aging populations, late diagnosis, weak early detection systems, and gaps in treatment infrastructure. The minister commended the organizers for advancing the African Union Agenda 2063 vision of an integrated Africa and praised Shefa Aloma Hospital in Luxor, which delegates toured earlier in the day, describing it as a phenomenal creation Africans should be proud of. He highlighted reforms in Nigeria's cancer control system over the past 31 months under President Bola Tinubu's administration, noting increased budgetary allocations for cancer prevention and care, the establishment of 6 new cancer centers of excellence, and procurement of specialized oncology equipment. On cervical cancer, the minister reported significant progress. Nearly 15 million girls aged 9 to 14 years have been vaccinated against HPV since its inclusion in Nigeria's routine immunization program in 2023. He also said the National Task Force on Cervical Cancer Elimination aims to screen at least 50% of eligible women and treat all detected precancerous lesions by 2027. Addressing the financial challenges of cancer care, Dr. Salako said Nigeria's National Health Insurance Program is finalizing a scheme covering cancer treatment. He urged African countries to prioritize healthcare pan-Africanism, emphasizing collaboration, resource sharing, and unified strategies. Dr. Salako reaffirmed Nigeria's commitment to the emerging Africa Oncology Network, describing it as a critical tool for a unified continental response. Salako stressed that the initiative should involve policymakers, healthcare providers, pharmaceutical companies, entrepreneurs, and technology firms with a focus on value-based care and equity. Former Senate leader Ali Ndume has appealed to President Bola Tinubu to withdraw the list of Nigerians he sent to the Senate for screening and confirmation as ambassadors, explaining that his appeal was based on his observation that the list as presently composed breaches the federal character principle enshrined in the Constitution of the Federal Republic of Nigeria, 1999. His argument stemmed from the fact that while certain states have 3 and 4 nominees each, Gombe, for example, has no representation. It also noted that only a nominee from Yobe, Senator Adamu Garba, died last July. The entire Northeast has 7 nominees on the list, while Southwest Zone alone has 15 nominees. The Northwest and Southeast have 13 and 9. North Central has 10 nominees on the list of career and non-career ambassadorial nominees, while South accounts for 12 nominees. Ndume, who represents Borno South, explained that the list of nominees contravenes Section 14 of the Nigerian Constitution. He urged the President to withdraw that list and present a fresh set of nominees that will align with the spirit of the Constitution of the Federal Character Principle.